Vitamins are essential nutrients that our bodies require in small amounts to function properly. Among this family of essential nutrients, vitamin B12 stands out as a true unsung hero, often overlooked but indispensable for our overall health and well-being. Vitamin B12, also known as cobalamin, is a water-soluble vitamin that plays a vital role in many critical bodily functions. While vitamin B12 is essential for our health, many people are unaware they may be deficient in this crucial nutrient. This deficiency can affect people of all ages, but certain groups are particularly vulnerable, including older adults, vegans, and those with gastrointestinal disorders. Fatigue and weakness are common symptoms, but are often mistaken for other conditions. As vitamin B12 plays a crucial role in nerve function, its deficiency can lead to neurological symptoms such as tingling and numbness in the extremities. Beyond the more common symptoms, vitamin B12 deficiency can manifest in various ways, often mimicking other health problems. Cognitive impairment, ranging from mild forgetfulness to severe confusion, can significantly impact daily life. Studies have shown a link between B12 deficiency and an increased risk of depression and anxiety. In extreme cases, untreated B12 deficiency can result in permanent nerve damage, emphasizing the importance of early detection and treatment. Vitamin B12 is like the conductor of an orchestra, ensuring all instruments play in harmony to create a beautiful symphony. In our bodies, this symphony is energy production, a complex process that relies on various nutrients working together seamlessly. Without enough B12, the factory slows down, production falters, and we feel the effects as fatigue and low energy levels. Ensuring adequate B12 intake is like giving our bodies a tune-up, optimizing energy production and keeping us running smoothly throughout the day. The brain's best friend, B12 for cognitive function. Think of B12 as a guardian angel for our brains, protecting them from damage and ensuring optimal cognitive function. B12 deficiency can damage the myelin sheath, disrupting nerve signaling and potentially leading to cognitive impairment. Furthermore, vitamin B12 is involved in producing neurotransmitters, chemical messengers that allow neurons to communicate. Red blood cell powerhouse B12 for oxygen transport. Vitamin B12 acts as a crucial component in the production of these red blood cells, ensuring our bodies have an adequate fleet of oxygen carriers to meet their demands. Without enough B12, our bodies can't produce enough red blood cells, leading to a traffic jam in our circulatory system and oxygen shortages throughout our tissues. This type of anemia can cause a range of symptoms, including fatigue, weakness, shortness of breath, pale skin, and neurological problems. The B12 deficiency maze. Navigating the symptoms. Vitamin B12. Deficiency can be a silent stalker, lurking within our bodies for years before announcing its presence with noticeable symptoms. One of the earliest and most common symptoms of B12 deficiency is fatigue, a persistent lack of energy that isn't relieved by rest. Another common symptom of B12 deficiency is weakness, a general feeling of lack of strength or energy. Feasting on B12, natural dietary sources. This essential vitamin is primarily found in animal-based foods, making it crucial for those following plant-based diets to be particularly mindful of their B12 intake. Among these, meat stands out as a prime source, with beef, poultry, and fish offering a substantial supply of this vital nutrient. Dairy products, another valuable source of B12, provide a creamy and delicious way to replenish our body's stores. Beyond the plate-fortified foods and supplementation, many breakfast cereals, plant-based milk alternatives, and nutritional yeast products are fortified with B12, making it easy to sneak in extra doses throughout the day. Supplements, available in various forms such as tablets, capsules, liquids, and even nasal sprays, offer a more direct approach to replenishing B12 stores. Consulting with a healthcare professional before starting any new supplements is always recommended to determine the appropriate dosage and form for individual needs. When food isn't enough, recognizing absorption issues. B12. Absorption requires a special passport, a protein produced in the stomach called intrinsic factor. Certain medical conditions, such as pernicious anemia, can severely impair B12 absorption. Furthermore, age-related changes in the digestive system can also affect B12 absorption, explaining why older adults are more prone to B12 deficiency. Section 4. Tailoring your intake. Factors influencing B12 needs. Just as our clothing sizes vary, so too do our nutritional needs. Factors like age, diet, and health status influence B12 needs. Pregnant and breastfeeding women have increased B12 demands. Vegans and vegetarians need careful planning and supplementation. Health conditions affecting nutrient absorption can increase B12 deficiency risk. Genetic variations can also impact B12 absorption and utilization. Section 1. The silent cries for B12. Recognizing the symptoms. Our bodies are intricate, often compensating for deficiencies before sounding alarms. Vitamin B12. Deficiency can be a silent infiltrator, chipping away at our well-being. Recognizing subtle cues is crucial, as B12 deficiency often mimics other ailments. Imagine our bodies as finely tuned instruments in the orchestra of life. When B12 levels drop, it's like a musician losing rhythm, disrupting our health. Fatigue, the first whisper of B12 deficiency, lingers even after rest. Section 2. Fatigue's foe. B12 and energy drain. Energy production is a complex symphony, with B12 acting as the conductor. When B12 levels dip, we feel drained and depleted. B12 is like coal for our cellular power plants, essential for energy. Without enough B12, our cells struggle, leading to fatigue. Our brains, the command centers of our bodies, are intricate networks of billions of neurons that rely on a delicate balance of chemicals and nutrients to function optimally. Vitamin B12 in this complex neural landscape acts as a guardian, protecting our cognitive function and ensuring clear thinking, sharp memory, and stable moods. Imagine our brains as vast libraries, housing our memories, thoughts, and emotions within their intricate shelves. B12, in this analogy, acts as the diligent librarian, ensuring the books are well organized, easily accessible, and protected from damage. Without enough B12 librarians, our mental libraries become chaotic, information gets misplaced, and our cognitive abilities suffer. One of the ways B12 safeguards our cognitive health is by protecting the myelin sheath, a fatty layer that insulates nerve fibers, allowing for rapid and efficient transmission of nerve impulses. This myelin sheath acts like the insulation around electrical wires, preventing signal loss and ensuring smooth communication between neurons. B12 deficiency can damage the myelin sheath, disrupting this intricate communication network and leading to cognitive impairment. Furthermore, B12 is involved in producing neurotransmitters, the chemical messengers that allow neurons to communicate. These neurotransmitters, including serotonin, dopamine, and norepinephrine, play crucial roles in mood regulation, learning, memory, and attention. B12 deficiency can disrupt the production of these essential chemicals, potentially contributing to mood disorders, cognitive decline, and difficulty concentrating. Our nervous system, a vast communication network spanning our entire bodies, relies on vitamin B12 for its proper functioning. When B12 levels dwindle, this intricate network can start to short-circuit, leading to a range of neurological symptoms that can be both alarming and debilitating. Recognizing these symptoms early is crucial, as prolonged B12 deficiency can cause irreversible nerve damage. Imagine our nerves as a complex system of telephone lines, carrying messages from our brains to every corner of our bodies and back. B12, in this scenario, acts as the insulation that protects these lines, ensuring clear and uninterrupted communication. When B12 levels fall, this insulation degrades, leading to crossed signals, dropped calls, and a breakdown in communication. One of the most common neurological symptoms of B12 deficiency is paresthesia, a sensation of tingling, numbness, or pins and needles often felt in the hands and feet. This unsettling sensation caused by nerve damage can interfere with our ability to grip objects, walk steadily, and perform everyday tasks. In more severe cases, B12 deficiency can lead to ataxia, a loss of balance and coordination that can affect our gait and make even simple movements, like walking or buttoning a shirt, challenging. This loss of coordination stems from damage to the nerves that control our muscles and movements, highlighting the importance of addressing B12 deficiency promptly to prevent long-term neurological complications. While vitamin B12 is essential for everyone, certain groups are more susceptible to deficiency due to factors influencing their ability to absorb, utilize, or obtain sufficient amounts of this vital nutrient. Identifying these vulnerable populations is crucial for implementing targeted interventions and preventing the debilitating consequences of B12 deficiency. Imagine our bodies as ships sailing the vast ocean of life, each equipped with a unique set of sails designed to navigate different weather conditions. Some ships, however, may have damaged sails or weaker hulls, making them more vulnerable to rough seas and requiring extra care to stay afloat. Similarly, certain individuals and groups face unique challenges in maintaining adequate B12 levels and may require additional support. One such vulnerable group is older adults, who often experience age-related changes in their digestive systems that can hinder B12 absorption. As we age, our stomachs naturally produce less gastric acid, which is essential for releasing B12 from the food we eat. This decline in gastric acid production explains why older adults are more prone to B12 deficiency, even if their diets contain sufficient amounts of this vital nutrient. Individuals following plant-based diets, particularly vegans who consume no animal products, constitute another group at risk of B12 deficiency. Vitamin B12 is primarily found in animal-based foods, making it challenging for those following strict plant-based diets to obtain sufficient amounts through diet alone. Fortified foods and B12 supplements are essential for vegans and vegetarians to prevent deficiency. Embracing a vegetarian or vegan lifestyle offers numerous health and environmental benefits, but it requires careful attention to certain nutrients, particularly vitamin B12. As this essential vitamin is primarily found in animal products, those following plant-based diets need to be proactive in ensuring adequate B12 intake through fortified foods and supplementation. Imagine our bodies as gardens, flourishing on a diverse array of nutrients obtained from the foods we consume. While plant-based diets offer an abundance of vitamins, minerals, and antioxidants, they lack a natural source of vitamin B12. This means those who abstain from animal products need to fertilize their bodies with B12 through alternative means. Fortified foods such as breakfast cereals, plant-based milk alternatives, and nutritional yeast provide a readily available source of B12 for those following vegetarian or vegan diets. These fortified foods are enriched with B12 during processing, making it easy to incorporate this essential nutrient into daily meals and snacks. Supplementation offers a more direct approach to addressing B12 needs in plant-based eaters. Vitamin B12 supplements are available in various forms, including tablets, capsules, liquids, and even nasal sprays, providing flexibility and convenience for individuals with different preferences. Regular monitoring of B12 levels through blood tests is crucial for vegetarians and vegans, especially during periods of increased demand, such as pregnancy or breastfeeding. Consulting with a healthcare professional or registered dietitian can help determine the appropriate dosage and form of B12 supplementation based on individual needs and dietary habits. As we age, our bodies undergo changes that affect our ability to absorb nutrients, including vitamin B12. Maintaining optimal B12 levels is crucial for physical and cognitive health. Imagine our bodies as vintage cars needing regular maintenance. Aging bodies may require dietary modifications or supplementation for adequate B12. Decline in gastric acid production with age affects B12 absorption. gastric acid is crucial for releasing B12 from food. Reduced gastric acid makes B12 extraction less efficient. Conditions like atrophic gastritis impair B12 absorption. Atrophic gastritis damages cells producing intrinsic factor, essential for B12 absorption. Medications like PPIs for heartburn can interfere with B12 absorption. PPIs suppress gastric acid, hindering B12 release from food. When digestion falters, we encounter malabsorption and B12 deficiency. Our digestive systems are remarkably intricate, breaking down the food we eat into smaller molecules that our bodies can absorb and utilize. However, various factors can disrupt this intricate process, leading to malabsorption, a condition where our bodies struggle to absorb essential nutrients, including vitamin B12. Imagine our digestive systems as complex assembly lines, meticulously disassembling food and sorting its components for absorption. Malabsorption is like a wrench thrown into this intricate machinery, disrupting the smooth flow of nutrients and leaving our bodies starved for essential building blocks. Certain medical conditions such as celiac disease, Crohn's disease, and inflammatory bowel disease can damage the lining of the small intestine, the primary site of B12 absorption. This damage disrupts the delicate finger-like projections called villi, which increase the surface area for nutrient absorption, reducing the gut's ability to absorb B12 effectively. Surgical procedures that remove portions of the stomach or small intestine, such as gastric bypass surgery or bowel resections, can also impair B12 absorption. These procedures alter the digestive tract's anatomy and can reduce the surface area available for nutrient absorption, potentially leading to deficiencies. Certain medications such as proton pump inhibitors for heartburn and acid reflux can interfere with B12 absorption by reducing gastric acid production. While proton pump inhibitors effectively alleviate digestive discomfort, long-term use may require regular monitoring of B12 levels and potential supplementation. In the intricate tapestry of human health, vitamin B12 stands out as a vibrant thread, essential for maintaining the integrity and vitality of our physical and cognitive well-being. From fueling our energy levels to safeguarding our cognitive function, B12 plays a diverse and indispensable role in orchestrating the symphony of life within our bodies. Ensuring an adequate intake of this vital nutrient is not merely a dietary suggestion, but a fundamental pillar of a healthy and fulfilling life. Throughout this exploration of vitamin B12's significance, we've journeyed through its multifaceted roles, uncovering its crucial contributions to energy production, red blood cell formation, nerve function, and cognitive health. We've delved into the rich landscape of B12 sources, from naturally abundant animal-based foods to fortified alternatives and convenient supplements, providing a comprehensive guide for navigating the B12 landscape. Understanding the subtle signs of B12 deficiency, often masked as common ailments like fatigue and weakness, is paramount for early detection and intervention. We've shed light on the vulnerable populations, including older adults, vegans, and individuals with malabsorption disorders, emphasizing the importance of tailored approaches to B12 intake based on individual needs and health conditions. Just as a conductor guides each instrument to create a harmonious melody, maintaining adequate B12 levels ensures our bodies function in concert, allowing us to thrive physically, mentally, and emotionally. By prioritizing B12-rich foods, considering supplementation when necessary, and seeking medical advice when deficiency is suspected, we empower ourselves to lead healthier, more vibrant lives. In the hustle and bustle of modern life, we often miss the subtle cues our bodies send us. Vitamin B12 deficiency can erode our well-being, leaving us drained and foggy-headed. Recognizing early signs like fatigue and weakness is crucial. Take proactive steps to restore balance and consult a healthcare professional. Vitamin B12, often hailed as the energy vitamin, is much more than just a nutrient. It's a fundamental building block for a vibrant and fulfilling life. B12 supports our energy levels, cognitive function, and countless bodily processes, ensuring we live each day with vitality and purpose. Just as a well-tuned engine powers a car, adequate B12 levels empower our bodies to navigate daily life with ease. B12 doesn't just add years to our lives, it adds life to our years. When we feel energized and our minds are sharp, we're more present in our relationships and more productive. Embracing B12 is a testament to the power of long-term, sustainable health practices.